What are the biggest challenges you foresee in undertaking this project?
You know, one of the challenges I think is what we already talked about. We work in a very, very busy urban system that has a huge amount of demands on the currently existing resources, and we're sitting around the table talking about expanding the things we're gonna do with the same number of resources. And so, as Eddie said, in the beginning, it's gonna be a lot of extra work, but we think that the dividends it will pay in the end for patients are worth it, is worth it.
I think just to echo Joe, I agree completely. I mean, I think because we all believe in the program and our partners believe in the program, that we're willing to take that on because we do, I mean, our goal is to serve the community and do what's best for them and to make sure that they get the right, care and the right prevention program. So this would be just, something that we all believe in and would work towards.
Here, two other thoughts on that. One would be, we're already seeing our, in the context of healthcare reform, we're already seeing our hospital partners pay very close attention to the care that EMS is delivering in our city today. Our STEMI system of care, our stroke system of care, our trauma system of care, the services, the healthcare services provided by the Chicago Fire Department today are hugely important in the outcomes that those hospitals are realizing. We recently took on cardiac arrest as a state with a very targeted effort here in the city under the leadership of the fire commissioner. And we're doing active measurement, we're doing ongoing education, we've altered our triage algorithms to really try to improve the outcomes of patients. And that's what's of interest to payers, that's what's of interest to hospitals, that's what's of interest to patients. And so the type of services that we're talking about here are the same value-added model, in the sense that if we can invest up front and impact outcomes downstream, there's a value proposition there that can really strengthen the healthcare system in Chicago. The other piece is, I think a lot of people think of an urban city as a resource-rich environment, and it certainly is, but there should be no mistake that it's still a hugely underserved population in terms of healthcare. And a lot of that is healthcare access issues. We have a large part of the population that's underserved in terms of access. The other part is that our system is so complex with so many different healthcare entities within the city, both city agencies and hospital agencies, healthcare system agencies. It's very hard to navigate that system. And so the opportunity for mobile integrated healthcare in a resource-rich, underserved population is to help with access and to help with navigation.